Hello, I am Javier Zulueta. I am the Chief of Pulmonary Critical Care and Sleep Medicine at Mount Sinai Morningside in New York, and I'm Professor of Medicine at the ICANN School of Medicine. I have been involved with lung cancer screening and lung cancer management for all my career, and I am here today to talk to you about a very exciting new program that we have, which is Incidental Lung Nodule Program, and answer questions about lung nodules that you might have. So what are lung nodules? The first question is seems like a simple one, but how do you define a lung nodule? Well, maybe the simplest way to do it is to say that it's like a spot in the lung. Like we have, spots on in the skin, for instance, or we can have spots in the lung. That's the definition of a nodule. Other people call it a growth. It's a change in the consistency of the lung tissue. Lung tissue is like a sponge with very fine little bubbles. And if any part of the lung gets filled up with whatever other cells that shouldn't be there, they can create a little spot. And, infections, inflammation, many causes can create these nodules. And actually, the great majority of these nodules are not cancer. But cancers start out as little nodules, little spots that grow. And that's the key for us to manage these findings on the chest CT. If we see growth, then is when we really suspect that it might be cancer, and we intervene with a diagnostic procedure, whatever. But initially, a lung nodule is a spot, and just by looking at it, you can really not tell whether it's a lung cancer or a benign inflammation of some sort. So that is why we need these programs to work them up. What does it mean to have an incidental lung nodule? Today, in the United States and in the world, the number of CT scans done for diagnosis of many diseases is increasing tremendously. In the emergency room, if somebody goes because of any pain in the abdomen or in the chest for whatever reason, it is very likely that you might have a CT scan. Even with CT scans of the abdomen, you will catch part of the lung, and you might be able to find abnormalities in the lung. So incidental lung nodule is when you find the lung nodule on a chest CT when the reason for the chest CT was different, was done for whatever reason, not to look for lung nodules. It wasn't a lung cancer screening, chest CT, for example. When you do a chest CT because somebody has pain on the side because the person fell off a bike, for instance, and you find a lung nodule, that's an incidental lung nodule. And the fact that it's incidental means that it was caught by chance because you did that CT scan. But it gives us an opportunity to catch or to detect cancers early, because lung cancers do not produce symptoms until they're very late in their development, until they're in late stages, 3 or 4, when they've invaded other tissues, other organs that do cause symptoms. The lung in and of itself does not cause any symptoms when there's a lung tumor growing, because it has no nerves that cause pain or anything like that. So we will not know that we have a tumor until it becomes invasive into other structures. So an incidental lung nodule, if we find a little small lung nodule, and there is a good chance, not a good chance, but there is a significant chance that those nodules can be cancer, there we have an opportunity to diagnose it early. And that's why we're setting up this program of incidental lung nodules here at Morningside, at Mount Sinai Morningside. So what happens at Morningside if a lung nodule is found on a scan that was performed for a different reason? Essentially, you're going to have a report. The radiologists do a very good job in detecting these nodules and in recommending what should be done with the nodule, depending on several factors that they consider according to guidelines, depending on the size of the nodule and the consistency of the nodule. The nodules on a CT scan may appear like solid, or they may appear like transparent, what we call subsolid or ground glass nodules. Depending on what type of nodule and what size, the radiologist is going to recommend repeating a CT scan in 3 months, 6 months, or not needing any more CT scans until maybe a year, or not needing any CT scans at all because the patient doesn't have any risk factors and the nodule is small enough. So the recommendation is going to be in the CT report, and the doctor who ordered the CT scan and you should follow the recommendations that show up on that report. So what happens if the CT scan was performed in the emergency department? Well, it's the same situation. You're going to have a report on your CT scan where if you have a nodule, the radiologist is going to indicate the size, the characteristics of the nodule, and what follow-up should be performed. In our new program that we're developing, what we're going to do is to track all those nodules that are detected incidentally in our system. And we will make sure that your primary care physician and that you know about the finding to make sure that the tests that the radiologist recommends are actually done. So what we want to avoid is that within all the information that you might get as you leave the emergency department with different reports on different tests, that the nodule recommendation is not lost, and that we actually act on the recommendations that the radiologist has written in the report. So it is important to follow up the recommendations or to follow up with new tests in certain circumstances, because a percentage of those nodules that we detect incidentally can be lung cancer. As I said at the beginning, lung cancer is a disease that can grow and grow and grow without causing symptoms. And when it does cause symptoms, most of the time it's already in advanced stages where you cannot cure it with lung surgery. So we want to make sure if we have the opportunity of seeing a lung nodule that might be a lung cancer early on, we want to act on it. So you have to think that the chances of a lung nodule being lung cancer are low, but they're not zero. It is estimated that maybe 5% maybe of lung nodules are lung cancer. So imagine this: out of 100 people who have a CT scan done for whatever reason, 20 might have a lung nodule detected. And of those, one might be a lung cancer. So again, that is an incredible opportunity to detect that cancer early and to act on it. We can cure that cancer with surgery. If it goes beyond the stage 1 or stage 2, the cure of the cancer is almost impossible. There are very good treatments for advanced cancer, but we're not talking about cure with surgery, which is what we would like to aim for. So if you're notified about an incidental lung nodule, what you have to do is follow the recommendations of the radiologist. You might have a CT scan done where the radiologist does not write a recommendation. Then I would contact a specialist in lung nodules. They will tell you, according to the image, they will probably ask you to bring the CT scan with you and look at the images and say, okay, well, this is a lung nodule of certain of these characteristics, this size. You should follow up with a CT scan in 3 months. This is an example. Again, there are very well-defined guidelines as to how to follow up nodules depending on several characteristics of the nodule. So if you are told that you have a lung nodule, you should ask, are there any recommendations? If there are, follow them. If there aren't any recommendations that come with the nodule in the report, then you should seek a specialist in lung nodules. So I have a lung cancer. Does that mean that I have a lung cancer or I will get lung cancer? No. Again, going back to a previous question, the great majority of lung nodules are benign, are scars. We're breathing air into our lungs continuously. Many people breathe more than air, like cigarettes, which is not recommended. But at the end, it's foreign substance that is not designed to be in the lungs and can cause inflammation. It can cause infections. It can cause many things that can leave scars that look like small spots in the lung. So most of those lung nodules that we detect are benign, are not concerning. However, we don't know that in our first look at it. We will know that it is benign after we followed it for a period of time and we realize that it did not grow. So no, the majority of nodules are not lung cancer, but you have to follow them. So after you see a doctor about a lung nodule, what happens next? I think this question has been answered with the previous answers. You're going to be told that you should either come back for a follow-up in 3 months, you should come back for a follow-up in a year, you don't need a follow-up, or you should have a biopsy right away. It will all depend on how the nodule looks, what characteristics it has, how large it is, and your risk factors. So as an example, if you're 18 years old and you fell off a bike and you have a CAT scan done and you see a little small nodule, you are not going to need any follow-up because your risk of having lung cancer is zero. If you are 65 years old and you've smoked most of your life and you have a small nodule, you're going to be told to come back in 3 months, most likely, to have another CT scan because your risk factors put you at a different category of risk. And we want to make sure that that nodule is not lung cancer. So most of the times the question is, will I need to get another scan and what other tests might be performed? Most of the times, the next test that needs to be done is another scan, yes. That will allow us to determine whether the nodule is growing or not. When a nodule is growing, our suspicion for lung cancer increases significantly. If the nodule is stable or if it disappears, we consider it to be benign most likely. If it disappears, it is benign. If it is stable, we consider it to be benign most likely. And we will continue following until we have a period of time. Usually, by consensus, we say that 2 years of no growth means that a nodule is benign. So what you're going to be told is, again, to come back for follow-up, and we're going to keep an eye on those nodules just to make sure that there's no growth. How often will I need to follow up? I think this question is answered. Depends on the nodule that you have. You might not need any follow-up, or you might need a CT scan in 3 months, then at 12 months, and then maybe 24 months. And that would be it if there's no growth. If there is doubt or if the nodule is changing, you might need more frequent follow-ups. That will depend on the nodule itself.